Kim with the one, the only, the Lymph Mojo Master, Dr. Perry from Stop Chasing Pain. We just spent the day filming a blood flow webinar, which ironically enough is pretty on point for what I've been dealing with the endometriosis diagnosis and procedure that I went through. So I wanted to shed some light on what we already know is a huge factor in treating a full body inflammatory disease such as endometriosis. So I wanted to ask you, Dr. Perry, do you have any advice for the women out there who are suffering with this or recovering from a surgery? Any insight that you can give them or advice, things that they can do for themselves?
Absolutely, absolutely. Well, thank you so much for inviting me to be here. Whenever you have the endometriosis, you're always going to be dealing with inflammation, usually chronic inflammation that's been there for a long period of time. And in your case, it was years, right?
Yeah, at least 15 years, I'd say, 15, 20 years.
Yeah, and that's what you're going to find often when you have this diagnosis of endometriosis, that you've likely had something for a long period of time, and then all of a sudden you get your diagnosis. And what I teach everybody is that if you have inflammation of any type, particularly chronic inflammation, you always want to look at a few important and critical things. One is how well the lymphatic system works in your body, because that system is the #1 system that can help with inflammation, and it also gets rid of a lot of the waste that gets trapped inside of the body that can cause inflammation in the body. And you get a lot of things trapped down in that pelvic region when you have poor lymphatic flow around the abdomen and around the groin, and that traps things down in the uterus. And that will also end up compromising blood circulation. So blood circulation to that area for healing becomes compromised, and then getting blood flow out of that region, it gets trapped in there with the veins and the lymph, and then everything just sits here and gets stagnated, and then that brings about inflammation. And it can take a long time. It can take years, it can take decades, then all of a sudden you get hit with something. So removing that stagnation in there through some very easy lymphatic techniques and blood flow techniques. And here's the great part: when you go on these areas, you're going to help get better movement out of all of those. And you'll notice some crazy good changes that will happen just from a short thing that you do that we're going to teach you. You're going to teach it today, right?
Yeah.
And you just stay with it on a daily basis try to commit to it for a month and see how you feel. But look at it as like a lifelong process that you do, no matter where you are in the journey. If you're just beginning it, if you're right in the middle of it, if you're towards the end of it, but you're still dealing with it, you can still do the big 6 that we call it.
Mm-hmm.
You ready to do it?
Yeah.
Okay. So all the inflammation in the body from the lymphatic system is going to try to make its way out to the main drain, this exit point in the body, and that is at the collarbone. So everything that's trapped down in this region for you that's trying to get out, this is where it's trying to go. If it can't get here, then it stays down here, and then that doesn't work out well. So you'll get the inflammation. So this is spot #1 of the big 6. Working and massaging. You can do both at a time, but I usually like one at a time because it allows you to relax this area a bit. Just rub above the collarbone and underneath the collarbone gently. Don't cause any pain for 10 seconds, 20 seconds, somewhere in that ballpark. Easy. Just don't cause any pain. Rub in any direction you like. Circles and rotations work really, really well. And I like to add a little light tapping on top of that. So rub, then lightly tap below and above the collarbone. This releases the tension and opens up that lymph drain so stuff can get out. Then you do the same thing on the other side. So we started on the left and then you go to the right, but it doesn't matter which side you start on as long as you do both sides. So I'm going to rub here. And you may notice when you start this, oh wow, that area is a little tender. It feels a little puffy often. And you may notice most of your puffiness on the left side because that's where everything down in this region with the endometriosis is trying to go to the left side. All of us trying to go here. So I'm going to rub a little bit longer on this one. This side's a little jealous. And light tap, but no pain. That's spot 1. That opens the drain. Spot 2 is in the neck. It's on the side of the neck, right behind the angle of the jaw, below the lobe of the ear, or what they call cervical 1, cervical 2. That's the largest lymph node, which is basically called a mini toilet, M-I-N-I, that's trying to break all that stuff down and flush it out and kill all those things that are trying to take you out. So this is an area that's very, very important. This one you can do one at a time or both. So rub right behind that angle of the jaw here. You may also notice that that's quite puffy. Circles, spirals, up and down, and then lightly tap with a finger, with a couple of fingers. Now, if the tapping, you don't like it or it feels uncomfortable, then just do a couple of extra rubs, okay? So now 2 will drain out into 1, so that's gonna help everything up here feel better. Now 3 is at the shoulder joint right here by the pectoral muscle and the armpit. That's called the axillary lymph nodes. Same thing here. Take a finger and just rub over that pec in front of the shoulder, coming underneath a little bit and towards that armpit. You can rub a little bit harder here because it's a bigger muscle. Circles, spirals, and now tap. At the pec, underneath the armpit a little bit, just like here. And then now this is going to start rushing in towards number 1. Now we do 3 over here at the other shoulder. I haven't done this today, so this is good. Okay, and then tap. Now, super important. These are all important, but 4 is the abdomen, the entire abdomen. This is where most of your lymphatic system lives, and it's where most of it gets stuck. That's important for you with endometriosis because all the inflammation that's here must get past spot number 4 in order to get to spot number 1. That's why going and doing stuff here can get very frustrating because if you're not opened here, it doesn't have anywhere to go and it just stays there. And you actually feel worse sometimes when you do stuff here and you haven't opened up what we call the flow routes. So with the abdomen, you've got your navel. So if you find your navel and you have above, I like to go with my hands over the whole thing, the navel and above, and just rub in different directions. Circles, rotations, go side to side, go up and down. Get in there a little bit more, like you're just trying to move your organs around a little bit. Go gentle if there's some discomfort here, which might be if you're having a flare-up. Then lightly tap at the navel and above. Go to what's comfortable. Now I will tell you, I would like for you to spend more time here at 4 than other places because there's so much here. And when you do your tapping, you can aim for 50 taps. Like that's a good number to go, right? Now, once that opens up, you'll probably start to feel better already. Then we go to spot number 5, which is the crease of the groin, and that's called your inguinal lymph nodes. Those will likely be swollen and tender on you as well, because when things get stuck here, they backflow down and the ones underneath take a hit. So here, you go across the crease of the groin. You can go with the crease or up and down over the crease, and I really like circles here. but just whatever you feel good with. And then tap. So that opens up the inguinal ones. And then the last one is spot number 6. That's behind the knee and what they call the popliteal, or the joint space behind the knee. You may find that surprisingly tender and swollen. So rub there, behind the crease, below the crease, and above the crease. Get in there pretty good. And then do your light taps behind the knee. Now, what I would like for you to do, okay, is because many of you probably have not worked your lymphatics, maybe ever, or if so, not in a long time, or maybe never like this. Everything now is trying to go towards number 1, and number 1 can get overloaded because there's so much coming at it. So I'm going to give you a bonus. After you've done 1 through 6, I would like for you to go back and rub 1 again a little bit. This will open and make sure that it's open, okay? And then once you do that, you can just kind of take your shoulders and shrug them up a little bit like this, and then that'll be like a pumping mechanism. It's going to help pull all that stuff up into this region. And then hang on, because you're going to feel a difference. And try to do the big 6 on a daily basis if you can. Once a day is plenty. Don't overdo it. It doesn't matter if you do it in the morning, in the afternoon, or the evening. That's entirely up to you. Okay? The amount of time you spend there, the amount of rubs, the amount of taps, the directions, the movements, the pressure, that's all variable. You can change that out depending on what you like. That's okay, just don't cause pain. The most important thing is always do it in that order, 1 through 6, and revisit 1. I'll use the word mess up, but if you get those areas and you do them all over, it won't be the same. That's really, really important. Stick with that for 30 days, and I guarantee you, you're going to feel a difference.
And I can vouch for that as well. So thank you, Dr. Perry. Appreciate you
welcome.
taking the time to help educate and advocate for endometriosis. And stay tuned. I'll be sharing a lot of the things that I've learned from Dr. Perry from being a patient and for doing these webinars. Things that I've been doing for years to treat this systemic inflammation, not knowing it was endometriosis, but I wouldn't have made it through the procedures and these years of trials and tribulations if it wasn't for this work. I wholeheartedly believe it's why I'm still here today, and that's why we want to share this information with as many people as we can. So
Absolutely.
Stay tuned. Thank you again, and we'll see you guys soon.